You filled out a report worksheet before, but if you forget, let me just go over some brief information about it. The report worksheet is a fillable sheet that gives us some brief information about the client, only using initials to protect patient confidentiality and making sure that we fill in the boxes appropriately, as we learned when we first started working with our patients in the simulation lab. And then what we do is we use 3 columns, and they're used as follows. We write the problem in an abbreviation so that we're not writing a lot. So for instance, for Mrs. Mannix, we might consider ineffective tissue perfusion, ITP cardiac. We put a / and then we jot down abbreviations for outcomes that we'd like to achieve. In the middle column, we only put the subjective objective data that measures that problem by what we would get from inquiry, asking our client, what we would get on exam, performing a physical assessment on the client, and what lab diagnostic tells us that client is experiencing the problem. Remember, we just put absolutely what is most important instead of filling all the space. The next thing we do is we start to put what are the monitoring protocols and what are the activities or nursing actions that we know will help to pick that problem, to fix that problem. And in addition, we put in what we think should be criteria to seek consultation. So let's look at an example. When we did this, we knew that the safest thing to do was to use the care plan. And here is ineffective tissue perfusion care plan for Mrs. Mannix. As you see right here, this is Mrs. Mannix's outcomes. We want her to have no chest discomfort, shortness of breath, nausea, vomiting, diaphoresis, no ECG changes, and we want her CKMB to be negative. That would go in our outcomes, and we can almost copy and paste it. What we want to think about is, how would I know she's experiencing it? And if we take a look here, this goes into what we would notice in clients. And then recalling that our client is diabetic and she's female, that she's probably not going to complain of chest discomfort. And we would look for other factors that might be associated with myocardial ischemia. And we'd put that in the middle. We'd also put in the most important data. And the most important data to say you're having a heart attack is if we see definitive criteria in a 12-lead EKG, or we see definitive criteria in diagnostics, troponin I and cardiac enzymes. Those are the first things we write in there. And then we put in the rest after that, so as not to cloud our minds with information that doesn't help us identify the problem. In interventions, we put the things that we want to make sure when we go into the room that we check are present. So for instance, we know a person who has ineffective tissue perfusion should have frequent vital signs, should have a 12-lead EKG with chest pain, should be on a cardiac monitor. So we would write those things in, and we would use check boxes for lab diagnostics that we know would be helpful to follow for that particular problem. We look at the client's current situation, what we get in report, to identify the top priorities. And that's how we approach our report worksheet.